It happens once every 45 seconds. It's the leading cause of long-term disability. It's the #3 killer in the United States. And it's preventable. In this video, you'll learn all about stroke, what it is, the warning signs associated with it, and how it can be prevented. Stroke is a type of cardiovascular disease affecting the arteries leading to and within the brain. It happens anytime a blood vessel in a vein bursts or becomes obstructed. Oxygen and nutrients then can't reach the brain. When that happens, part of the brain can't get the blood and oxygen it needs, so it starts to die. There are 3 different types of stroke: ischemic, hemorrhagic, and transient ischemic attacks. An ischemic stroke is the most common type of stroke. It happens when an obstruction occurs within a blood vessel. Hemorrhagic strokes are less common. It results from a weakened blood vessel that ruptures and bleeds into the surrounding brain. Transient ischemic attacks, or TIAs, are sometimes considered a warning stroke. In a TIA, conditions indicative of an ischemic stroke are present. However, the obstruction, or blood clot, occurs for a short time and tends to resolve itself. You should talk to your doctor to see if you're at risk, but you should also watch out for specific warning signs of stroke. Some include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion or trouble speaking. You have sudden trouble seeing in one or both eyes. You experience sudden trouble walking, dizziness, loss of balance or coordination. A sudden severe headache with no known cause. Here's a simple test that will help you detect stroke symptoms. Always think fast. FAST. Face. Ask the person to smile. Does one side of the face droop? Arms. Ask the person to raise both arms. Does one arm drift downward? Speech. Ask the person to repeat a simple sentence. Does the speech sound slurred or strange? Time. If you observe any of these signs, it's time to call 911 or get to the nearest stroke center or hospital. During a stroke, brain cells start to die, 2 million every minute. That's why immediate medical care is so vital when you experience symptoms of a stroke. If proper treatment isn't sought within 3 hours of a stroke, permanent disabilities or even death may occur. Contrary to what you might think, there are treatments available for stroke victims. Many of them involve surgery to manually remove the blood clot. For ischemic strokes, the most promising treatment is the FDA-approved clot-busting drug, TPA. This drug, however, must be administered within a 3-hour window from the onset of symptoms to work best. Generally, only 3 to 5% of those who suffer a stroke reach the hospital in time to be considered for this treatment. Depending on the severity of the stroke, some patients can experience paralysis or restricted mobility. Physical therapy and other rehabilitation services are common, so patients can return to a normal life. Everyone is at risk for a stroke. Some risk factors you can't control, like being a man, being over 65, being African American, or having a family history of stroke. But there are some risk factors that you can control. Know your blood pressure. If it is elevated, work with your doctor to keep it under control. High blood pressure is the leading cause of stroke. Have it checked at least once every year. If you smoke, stop. Smoking doubles the risk for stroke. If you stop smoking today, your risk for stroke will immediately begin to decrease. If you drink alcohol, do so in moderation. Having 1 drink each day may lower your risk for stroke. But if you don't drink, don't start. Know your cholesterol number. If it is high, work with your doctor to control it. Lowering your cholesterol may reduce your risk for stroke. Include exercise in your daily routine. A brisk walk, swim, or other exercise activity for as little as 30 minutes a day can improve your health in many ways and may reduce your risk for stroke. And finally, enjoy a lower sodium, lower fat diet. By cutting down on salt and fat in your diet, you may be able to lower your blood pressure and, most importantly, lower your risk for stroke. As debilitating as a stroke can be, There is treatment and support available for patients, and it's important to understand timing is everything, and immediate treatment is vital. But maybe the most important thing to understand is that strokes can be prevented, and a few simple adjustments to your lifestyle could translate into years added to your life.